condition which can affect otherwise healthy people and is potentially fatal. Now, a new link has been found between a faulty gene and the condition known as CPVT, which causes abnormal heart rhythms.
The research by the British Cardiovascular Society means that researchers are one step closer to new life-saving treatments.
I'm joined by Daniel Whitaker and his daughter Lillian, who both have the condition, as well as his wife Zoe. Welcome to all three.
We're also joined by Daniel's cardiologist, Dr. Luigi Venetucci. Morning all, thank you so much for joining us. Daniel, we'll come to you in a minute if that's all right, because I know you can explain to us what this particular condition is, can't you? And you've got some props which you can talk me through.
Yeah, so CPVT is genetic arrhythmia syndrome, so it's a condition caused by faulty gene, which was first described around 20-25 years ago, and around 12-13 years ago the breakthrough came and the gene responsible for it was identified.
Yes.
But then the question was, how does this gene leads to the irregular heart rhythms and the things? And with research supported by the British Heart Foundation, and we have been carrying out over the last 5-6 years, we have been able to clearly link the mechanism which link the abnormal gene to the irregular heart rhythms, and we have discovered that they are related to abnormal calcium levels in the cell, basically.
And it can lead to sudden death.
Yes, can lead to irregular heart rhythms that then affect the ability of the heart to pump, and then sudden
So, Daniel, you suffer from the condition, you know that now, but when did you first think there was an issue?
I actually had a cardiac arrest in 2006, but before that I'd had symptoms and kind of didn't really know what was going on.
So 2006, you're a young man, what are you, 23, 24 years old?
I was 20 years old
just 20 years
at the time.
And you're fit and healthy?
Yeah, I was. I used to do a lot of running. I actually competed at quite a high level, over 100 and 200 metres in athletics. So I was in prime condition. I used to train 6-7 times a week, really pushing my body to the limits. And then obviously had the cardiac arrest. And at the time I didn't know what it was. So I was at university at the time in my final year. I wanted to. So I was under a team in Newcastle and had a defibrillator put in place. And then I was put on medication as well to try and keep it under control.
So it's it's something that's manageable.
Yeah, and in 2011 the device was actually faulty, so I had to have a replacement device put in. And then from there I transferred my care back down to Manchester, and that's when they've been able to do all the genetic testing.
And the genetic testing has been particularly relevant to your family because you found out that Lillian has said gene. What does that mean for her, Zoe? What does that mean?
She was diagnosed when she was just under a year old. And for Lily at the moment it just means that she's medicated. She's under a paediatric cardiologist at Manchester Children's Hospital. And at the moment it's just monitoring, and as she gets older she'll be stress tested to see if she is symptomatic of it.
And it goes in both directions, doesn't it? Because you obviously have to check, because it's possibly passed through family link. You check both ways.
Yeah, well, like I say, at the time, because I was under Newcastle and the rest of my family had actually been having tests under Manchester, and I was kind of like the missing link. So as soon as I came down and they managed to find the gene, obviously they've then been able to test through the family. And my father also has the faulty gene as well.
Right, so Doctor, I wonder if you could sort of take us through a little bit of this, because we just heard Daniel explaining he was fit and healthy, 20 years old, and then suddenly this happens. Well, are there warning signs? Are there things people should be looking at?
In his case, there were warning signs, but they were not recognised, because when they happened, this condition wasn't known very well, basically. And really, over the last 10 years, our knowledge and understanding of this has grown exponentially. And we now run specialist services all over England. In Manchester Royal Infirmary, Manchester Heart Centre, we run a specialist clinic for this sort of
And you talk about warning signs. What are those? I mean,
what he said to you, so he basically was having problems with blackouts while he was swimming, blackouts when he had a fight at primary school with a friend. So there were warning signs, but it was around 15 years ago, and this wasn't really well known, and it was just thought to be a normal sort of blackout in a child.
Yes,
So
which could have become very, very serious.
could have been very, very serious for him. But fortunately now we know, we have identified all the family members who are at risk at this. We can keep a close eye on that, and the one they need will have the defibrillator.
And this is how you would fit one.
So
you've got an example.
So as Daniel has got it there, so we just put long wires that go in the big veins that are at the top of the heart and go all the way down to the heart, and then they connect them with a big box that goes under the skin. And what this device does is continuously checks the heart rhythm, and if it detects an heart rhythm which is life-threatening, it will give a shock. Stop it.
Well, I mean, it must be so reassuring for you to know that something's being done now as a family and for your daughter. I mean,
definitely, because like we said, I've got the defibrillator in, but like I said before, I actually had a faulty device which has had to be replaced. I've had inappropriate shocks as well in the past. So if they can develop and control it with medication, then no future's going to be.
Yeah.
Well, we wish you well. Thank you very much.
Thank you very much. Lillian, thank you very much as well.
Very well behaved.
It is just coming up to 19 minutes past 8. This is Breakfast on BBC News.